Equine health is our business. Horses and education are our passion.
Welcome to the EquiConnect podcast. Here we have case-based conversation and talk about interesting news and information with the goal of sharing knowledge, focusing on equine health.
This podcast is not a substitute for regular and emergency veterinary care. Our purpose is to inform and educate horse people, not to diagnose and treat medical conditions without a valid veterinary client-patient relationship.
Hi, and welcome to the latest episode of the McKee-Pownall EquiConnect podcast. I'm your host, Mike-Pownall, joined as always by Karen Foell. Karen, good morning. How are you?
Good morning. I'm well, thanks, Mike. How are you?
I'm doing really well. So we have a timely subject. We're recording this at the end of September, but as much as we don't want to admit it, very soon it's going to start getting colder at night and frosty, and winter is a-coming. So because of that, we are thrilled to welcome back a guest who we've had before, Dr. Kate Robinson from our Caledon location, to talk about fall laminitis. Welcome, Kate.
Thanks for having me.
So, as we said, fall is fast approaching, and as pumpkin-flavored treats are on our minds, maybe your minds, not mine. I just can't do them. Just can't do them. No. But we need to be aware of such timely topics as fall laminitis. So it happens. So let's get into it.
Yeah, so let's maybe have a little bit of a refresh. So, Kate, what is laminitis?
So laminitis is inflammation of the two main parts of the hoof wall, the lamellae that hold the coffin bone within the structure of the hoof. And probably the easiest way to think about it is like a Velcro attachment. And so if there's inflammation, fluid, etc., within that Velcro, it starts to spread and come apart. So number one, that's very painful. Number two, that means that the coffin bone is no longer sitting in a stable position in the foot necessarily. And so that can actually then lead to rotation of the coffin bone because the deep digital flexor tendon is pulling it away from the front of the hoof. Or it can lead to a sinking type of laminitis where those lamellae around the entire circumference of the foot essentially let go and the bony column descends within the hoof capsule.
So it's almost like when we rip our fingernail. It's kind of similar to that kind of, except we're not walking on one fingernail.
Exactly.
So Kate, why is fall such a risky time for laminitis?
Yeah, fall is risky for a couple of reasons, Mike. The first one you've already alluded to, those cooler nights, particularly paired with some of the warm days that we're still having, can have a really interesting and unfortunately for some of our horses, negative effect or consequence on the grasses that they are eating. So I like to think of grass as having sort of a cycle that it goes through every 24 hours. And normally when the sun is out, nice warm day, it's building up sugar and energy through that daylight period. And then overnight, it's using up those sugars that it created during the day to do a little bit of growing. And so it's usually at its sort of lowest sugar state early in the morning before the sun comes out again. But when we have a cooler night, particularly when we get below 5 degrees Celsius, the grass actually goes into like a mini hibernation on those nights. And so it doesn't grow. It doesn't use the sugars that it created the day before or during the daylight hours of that previous 24-hour period. And so coming into the next day in that early morning when we tend to think of grass being as safe as it gets, it's actually still in a pretty high sugar state. And so if we've got a horse that is has metabolic syndrome or has endocrinopathic issues that already put them at higher risk of pasture-associated laminitis, that fall high sugar grass can be quite risky for them. The second reason or concern that we have in the fall is there is a natural increase at this time of year as the days are getting shorter for ACTH to rise. And so that's a hormone that we think most commonly about with horses that have PPID or Cushing's disease. And it's kind of we think of it as the main driver, if you will, of that disease process. I'm not going to get into the pathophysiology of Cushing's disease. But so horses, even healthy horses, have a natural increase in ACTH at this time of year, and it helps them to prepare for seasonal changes, winter, storing fat, growing more of a winter coat, all those types of things. But again, in horses that are at risk, and we do know that horses that have PPID are at a higher risk of suffering from laminitis, we still, and by when I say we, that's the royal we, I'm talking about researchers and people much smarter than I am, aren't 100% clear on why horses with PPID develop laminitis. We know there's a connection between insulin dysregulation, but that the exact why is still being figured out. But we do know definitively that horses with PPID are more likely to suffer from laminitis than healthy horses of the same age. And so in this time of year, when that ACTH, which again is kind of the main driver of the disease PPID, is going through a natural increase, it's going to put those horses with PPID at an even higher risk of having a laminitic episode, because that ACTH that we know is somehow connected, we just don't know all the dots yet, is at a higher level in their bodies. I hope that makes sense. Do I need to clarify any of that?
Yeah, I just had thoughts of, having a huge pasta supper and not doing anything about it, as opposed to going for a walk afterward. There's a difference.
That's really fascinating about the grass as well. I actually didn't realize that, and that's really cool. It makes a lot of sense.
Yeah. I think that 24-hour cycle of grass and what it's doing, we don't think about it enough, probably, unfortunately.
Yeah, very interesting. It seems in Ontario this summer, a lot of veterinarians were seeing horses with a lot more cases of laminitis. Do you think this means we'll be seeing more cases of laminitis in the fall?
Yeah, I think it's tough to say, but I suspect so. I think we were seeing, this was an amazing growing season as far as moisture, sun, and heat, but that also means that the grasses, again, were probably maintaining higher levels of sugar than they normally do, and there was just more grass available for those at risk or borderline horses to be eating, and that probably threw some horses that maybe haven't had laminitic episodes before over the edge, right? And so I think as we enter the fall, yeah, we probably are at a little bit higher risk this fall because, number one, there's still more grass around for them to get into, unfortunately. And I think particularly, I have to admit I haven't looked at the long-term forecast, but if we have any more weeks like last week where we were getting down into single digits overnight, but then back up into the high 20s with a lot of sun during the day, that, as I've just said, with that 24-hour cycle of what the grass is doing and its sugar content, that's just a really great way to make some really, really rich grass this fall, unfortunately, if those weather trends continue.
So that seems to be like a pretty good rule of thumb, like cold nights, hot days, sun. Let's be careful.
Yeah. I think the other thing too that I wanted to mention, and this goes year round. But stressed grass is high sugar grass too. And I think a lot of us tend to think that the fall grass is safer because in a more typical year, and even now I'm looking out the window, like, you start to see those brown colors and it's looking over mature and like it's dying off, and it couldn't harm anybody, right? But no, stressed grass is high sugar grass, so that's another thing that we need to be aware of, and cautious with, particularly with our at-risk horses.
Kate, you talked about, PPID, and we'll get into that a bit more in a bit. We talked about metabolic. Are there different, horses in stage of life or breeds that would be more prone to these conditions, and by conversely then more prone to fall laminitis?
Yeah, so when we think about PPID, we think about our aging horse population. So somewhere between 20 and 25% of horses over 15 years of age are going to be affected by PPID. To my knowledge, and please correct me if I'm wrong, Mike, there's no breed predilection for Cushing's disease, PPID. It's more of an age thing. And so certainly if you've got a teenage horse, I think you want to be a little bit more aware and cautious with them. Even more so, those aging horses that have had metabolic issues throughout their life or have already had laminitic episodes, they're at an even higher level of risk. Even if they haven't been diagnosed with PPID, I think you need to be extra cautious with those horses. And then if we get into metabolic syndrome, yes, there are breeds that we think of being higher risk. Arabians, ponies, some lines of quarter horses are going to be at higher risk. Really, the ironic thing is those hardier breeds, if you will, those breeds of horses and ponies that were meant to exist on, sticks and scrub brush. When they are presented with a richer diet, tend to actually have issues with that that can then lead to things like insulin dysregulation, which we know is really the culprit behind laminitis in the vast majority of certainly our metabolic cases. It's really what is causing that to happen, and that's been shown in research projects, right? If we get horses into a high insulin state, you can create laminitis in those horses. So yeah, that's kind of PPID and metabolic syndrome in a nutshell, I think, in the relationship to laminitis there.
Kate, what are some of the symptoms people should be looking for in their horses if PPID is suspected?
Yeah, so some of the classic and I would say more advanced symptoms that we think of or see with PPID is that long, sometimes even like a bit curly hair coat that doesn't shed out properly in the spring, a pot-bellied appearance, mild depression, changes in attitude, holding on to fat deposits over particular parts of the body, inappropriate sweating, particularly in colder weather. You can see that. Laminitis, so forelimb lameness, or even signs of subclinical laminitis. So you might not see overt lameness or pain, but maybe the horse has multiple rings that are growing on their feet. Those rings are going to be tighter at the front of the hoof, the toe, versus the heels. Maybe the foot is starting to take on a bit of a like longer toe and almost dished type appearance. That would be another indicator of potentially subclinical laminitis. Chronic recurrent infections, in my experience, particularly pneumonia, and that's because, again, the immune system is negatively affected in horses with PPID, and so they have trouble fighting off infections that other horses might not even, be affected by.
So when we're looking at testing for these horses, I mean, there's clinical signs, but sometimes, especially if you have an older horse, you don't want to wait to the symptoms to happen. You want to get ahead of it. So, one of the things we test, particularly in the PPID horses, are we testing? What time of the year is the best time of the year to test for that?
Yeah, so as I've already talked about with the natural increase in ACTH, which is that main hormone that we think about with Cushing's disease or PPID, it's naturally increasing in the fall, and so if you've got a horse that is high, you're more likely to pick up the fact that they are abnormal at this time of year, whereas in a different season, they may come back as borderline on that ACTH test. So it can just be a little bit more definitive at this time of year. I would say that there has been a fair bit of research in creating reference ranges for each of the seasons. So we are, I think, better able to test at all times of year than we used to be, but probably still the best time of year to test, if we had to pick one, would be the fall.
That's great. That's great to know. Why? Because you often hear about people testing in the fall, and it's nice to know exactly why we recommend that.
Yeah, it's just more, a high level is just a little bit more reliable and true at this time of year.
What can horse owners do for horses if their horse is diagnosed with PPID or perhaps at risk in terms of feed, pasture, and exercise?
Yeah, it's a really great question, and it's sometimes tough. And I think the number one thing that we have to keep in mind when we're talking about what we can do, exercise is really great for helping to regulate insulin within the body, and therefore helping to maybe negate some of the effects of laminitis. But if you've got a horse in an active laminitic episode, you cannot and should not be pushing them to exercise, right? So we need to, use common sense there. We wouldn't want to make a bad situation worse. But as far as feed, you need to, with your veterinarian, plus or minus a nutritionist, I think the starting point is assess your horse's body condition score. If they are at an ideal body condition score, then we can be a little bit maybe less concerned about the sugar levels in their diet, right? We want to be conservative, but an ideal body condition score is going to have a little bit more leeway than a horse that is over conditioned or obese, right? Because that obese horse is, again, more likely to already be in a state of dysregulated insulin. So we need to be even more conservative about the sugars in their diet. But for me, I will be very honest with you. I think a lot of horses, regardless of body condition, breed, discipline, are probably being overfed. And so I would say keep it simple. A good quality grass, hay, ideally that has been tested so that we know what level of sugar, particularly non-structural carbohydrates, we are dealing with, should be the mainstay of all horses' diets. We should be feeding them at about a rate of 2% body weight per day. Again, that's going to vary a little bit depending on their body condition and what they are doing, but that's a good starting point for most horses. From there, we also need to make sure that they have access to water that is fresh, clean, potable at all times. And then adding on salt, other minerals, vitamins as needed to balance their hay diet. And there's a lot of really good ration balancers out there that provide very little in the way of calories, which is what we want in a ration balancer, and have been formulated for Ontario-based hay diets. If your horse then does need additional calories, that's where we get into adding grains and concentrate to the diet. And with a horse that has risk of metabolic syndrome or previous issues with metabolic syndrome and or PPID, we need to be really careful about the level of non-structural carbs in those concentrates that we are adding. Again, there are a number of products from a variety of feed companies that are formulated for those types of horses. And so that's where I would go for those types of horses, feeding as per label directions, or again, in consultation with your veterinarian or your nutritionist, as far as how much that individual horse needs, and keeping an eye on it over time. Again, adjust the horse's diet, caloric intake up or down based on their activity level, their body condition score, if it is changing, those types of things. And then with regards to pasture, in a horse that has had a episode of laminitis, pasture associated or not probably, or falls into that higher risk category for laminitis, such as having metabolic syndrome, maybe being suspicious of metabolic syndrome, or having PPID, we need to be really cautious about pasture. And a lot of those horses, unfortunately, probably just shouldn't be on pasture. The risk of setting them into a laminitic episode because of that uncontrolled access to the potentially higher levels of sugar in the pasture grass is just too much and not worth it, to be quite honest. In a lot of these cases, as much as we would love to have all horses out on, lush green pastures, sort of that idyllic picture on the hills of King, right? It's just not appropriate for all horses, unfortunately. And an ounce of prevention is worth a pound of cure, right? I think I said that correctly. So for those horses, sometimes we can compromise and maybe they only go out from like 4 a.m. till 10 a.m., right? When those sugars are going to be at their lowest. But again, as we come into the fall and those cooler nights, put that grass into that state of mini hibernation, managing that becomes even harder or next to impossible. Some horses that are at higher risk can be managed on pasture with wearing a grazing muzzle. But again, you need to be really careful with those. Some are good at getting out of their muzzles and gorging. Some are good at convincing their friends to take their muzzles off and gorging. And the other one that I have seen, just keeping an eye on the hole of the muzzle itself, particularly in those most common basket type muzzles that have the rubber at the bottom and it's just one hole that the horse is eating through. I have seen those holes become quite large over time because the horse's teeth are just kind of grinding through them, right? And so the muzzle loses its efficacy over time, unfortunately, and you can get into trouble that way. So again, if your living situation, management situation for your horse is such that you're not able to keep them off of pasture, but they are at higher risk. Talk to your veterinarian, come up with some strategies for how you can at least lower the amount of grass that your horse is accessing during the day. And if you're able to keep them on a dry lot or on a track type system where you're providing them grass, hay, and ways to sort of exercise and stimulate themselves in other ways, that can be just as good. Slow feed, hay nets are a great way to simulate grazing for horses. Spreading hay out over a large dry paddock or a track system. So again, we're encouraging movement and kind of more natural habits without allowing at-risk horses access to grass. Can be some really great ways to manage it. And back to the exercise piece, if the horse is healthy enough to do so, yes, exercise. And it doesn't have to be intense level exercise, but I think we can and should be putting in more time to exercise our horses. And I, believe me, I know better than anybody else how difficult time is to come by. But a 10-15 minute lunge is not really going to do a lot for your horse as far as burning calories and helping regulate that insulin. If you can get them out for a 45 or 60 minute active hack where maybe, you're seeing some hills, different terrain, but even just at the walk the entire time, I think your horse is going to be better served by that. And you're going to see better results with regards to weight loss and insulin regulation with that type of exercise versus the shorter sort of few times around the lunge line. But that's maybe my little soapbox, and I'll step off of it now.
Those are some really great suggestions and ideas. So thank you for sharing all of those. That was very, very thorough. Mike, I was really hoping to put you on the hot seat and ask you a question. And that is, what are some things that we can do to help the feet of these horses?
Well, yeah, I think we're going back to when I was a farrier and just, when I was shoeing as a vet, I was going to say I like these cases, but unlike laminitis that causes from other regions, I find these ones respond the quickest. And I think the key thing is working with the vet and other parts of the team, just because as Kate was talking about the exercise, feed restrictions, it's part of a whole package. But going back to when Kate was first starting at the beginning of, you have that Velcro bond at the front of the hoof, let's say, and around the hoof, and you have the tension of the deep digital flexor. And so when the Velcro is healthy, it resists the pull of the deep digital flexor. When the Velcro gets loose, it then becomes a self-perpetuating cycle where that tension is too much and it keeps on pulling. So a lot of what we're trying to do is minimize the stresses on the hoof wall. We could talk for 5 hours about different approaches, but I really think distributing the weight, or so the horse is standing there and has a shoe on or it's barefoot, most of the wall is taking up the load. So what other structures do we have that can take up some of the load to reduce the strain on the hoof wall? And a lot of areas where we can work on is the frog, the bars area, pretty well anything behind the tip of the frog. And so that's why some of these horses do well in a heart bar shoe applied properly, or a soft ride boot that will give them some support. There's a technique we use where you have them stand on, like insulation styrofoam, that 2-inch thick stuff. Depends on the side. It's harder on light horses like smaller ponies and they compress it down, and it sort of gives them a wedge, and so you have less of the tension of the deep digital flexor tendon, but it also gives support on what we call the caudal part of the foot from the point of the frog, or just behind the point of the frog back. that's another technique. There's some other soft pads that we can put on that will help. So they're like, to treat laminitis well, you need to have a huge toolbox because every horse will be a little different. But I think, just thinking of the theories of what we're trying to do is trying to offer that mechanical support to minimize the inflammation on the lamina and to minimize that pull of the deep digital flexor tendon. That's like my 2 minutes, because otherwise I'm off to the races and everybody's tuning out because it's like Mike's droning on my own things that I get really excited about.
No, that was great. Thank you very much.
Kate, I have a question for you, one of our last questions. So looking to next spring, because spring is another time when we have grass stress or pasture stress. Do we think, or is there evidence that horses that are more susceptible to fall laminitis are at a greater risk for spring laminitis?
That is an interesting question. I can't say that I've actually seen the two definitively linked, but yes is the short answer. In that,
kind of makes sense, doesn't it?
Yeah, it does, exactly. So I mean, really, regardless of time of year, if your horse is at risk, your horse is at risk, right?
Yeah.
And the reason that the spring then becomes an issue is that little bit of stress, as you said, of growing, but also the fact that it is growing and producing more sugars than it is obviously now in the fall and through the winter. It is rich, it's yummy. So there's also that aspect of just volume that horses eat at that time of year that can put them kind of over the top, if you will, and get them into trouble. But yes, if you're at risk in the fall, unfortunately, you're also at risk in the spring and vice versa.
Well, we'll bring you back in the spring so we can just offer people just quick tips. I mean, just sort of an addition to this one, because it's a bit of a different approach, but same underlying challenge.
Now, Kate, what is one of your most satisfying cases treating fall laminitis?
Yeah, I saw that question in the list, and I'm admittedly struggling to think of a specific case, and I apologize. But I think certainly I'm going to relate it to fall laminitis, even though it wasn't. I had a couple of cases actually in February, the same weekend that I was on call. And I think we just had a little bit of a warmer stretch. Snow melted, grass that had been covered became uncovered, and was kind of, trying to grow a little bit during the day and then going into that deep slumber overnight like it does in the fall. And this one horse in particular, at risk, metabolic type, had not had overt laminitic episodes before, but based on his appearance and radiographic findings, I suspect that there had been some subclinical stuff there. And so I think, even though it was February, it presented like a fall laminitis due to the sugar cycle in the grass, if you will. And he has done amazing. It took us a while. He was actually pretty severely rotated. So kudos to his farrier for getting him back, but also to his owner and the people that manage the facility that he is at. They no hesitation, all in as far as getting him on a dry lot, getting his pain under control, getting him on medications to help regulate his insulin. And as soon as he was comfortable enough, getting him in an exercise program, and I think that we were able to get, I want to say at least 100, maybe like 120 pounds off of him. And I actually just a couple weeks ago got a video update of him trotting around the round pen, and carrying the grandkids for their end of summer ride.
Perfect.
So that was really, really great to see. So yeah.
On that note, Kate, thank you so much for joining us today. This is a really complex subject, and it's one where, it's one we'll come back to frequently because, as you were saying earlier, there's so much research ongoing and there's still a lot of unknowns. And every year we gain a little bit of knowledge, which means we also add a few more questions. That's like anything. As you know more, you realize what you don't know. So this will always be an important subject for us.
And thank you for having me.
Of course. We look forward to having you again. And thank you very much to all of our listeners for checking out this episode of our EquiConnect podcast. Remember, this podcast is for you. If you have a topic that you'd like to learn more about, please let us know. Thank you.
Bye-bye.
This podcast is not a substitute for regular and emergency veterinary care. Our purpose is to inform and educate horse people not to diagnose and treat medical conditions without a valid veterinary client-patient relationship.